Robotic assisted heart surgery. Introduction. Robotically assisted surgery, it's also called as open heart surgery, and it is a minimally invasive surgery performed by a cardiac surgeon, and mainly it is designed to control the surgical instrument on this robotic box. What is robotic cardiac surgery? So the main advantage of robotic or cardiac surgery is here they will be cutting only very small cuts in the chest, and tiny instruments will be used by the robot control tools, and the surgeons will be able to do heart surgery in a way that is very less invasive, very less painful for the patient than when we are comparing with the open heart surgery. And this surgery can be also called as Vinci surgery because the name of the manufacturer who has made the robot called Vinci, so that's what it's called as Vinci surgery. Here you can see the diagram of robotic cardiac surgery, how we are performing. You can see the robotic arms. The robot has multiple arms, and there is a camera, and there will be an assisted nurse, and you can see that the surgeon has overall control on the computer console. And robotic surgery have been used for a number of different heart-related procedures, that is any valve surgery or coronary artery bypass or cardiac tissue ablation, heart defect repair and tumor removal. Why might I need robotic cardiac surgery? Why patient need a robotic cardiac surgery? Because the mainly why we are focusing the robotic heart surgery means it's only a minimally invasive compared with open heart surgery, and here we will make only a small incisions when we are comparing with open heart surgery, and the healing will be very much faster. And here the health provider may recommend robotic heart surgery because if the patient need an artery bypass procedure in order to improve the blood flow to the heart. So mainly it will be used to repair or replace any stiff or leaky heart valves, or in case of correct atrial fibrillation, that is that it's a common type of arrhythmia. And here you can see the normal heart and the heart with the atrial fibrillation. So you can see that the normal heart, the pacemaker will be an SA node of the heart. We started from the right atrium, and you can see the second diagram, that is an atrial fibrillation. Here there is an abnormal electrical pathway. So what will happen? It will be damage the electrical system. And in case if you want to remove a tumor in the heart or treat any congenital abnormalities, and even if there is any other reasons also, the healthcare provider may insist the patient to do that robotic cardiac surgery. What are the risks of robotic cardiac surgery? So more or less, so many benefits are there, and it has fewer risks also, the robotic heart surgery, because here the surgeon will not cut through the breastbone to open the chest, and this removes many of the complications. So open heart surgery, what they will do, the surgeon will be cutting the open the chest through the breastbone, but here when we are comparing with open heart surgery, it will be the complication is very less because it is not an open heart surgery, only they will make a small incision. And some robotic surgery even it will require anesthesia, and so some kind of risk will be involved. Even though if you are taking only a small incision, it has its own risk. That is mainly it may happen a heart attack, stroke, infection, or even death. And here, in some cases, doctor may not be able to complete the surgery with the robot. So what will happen? So sometimes the surgery may be incomplete with the robot, so better the doctor will be started doing open heart surgery. And they may have even other risk based on the specific medical condition. That will be depend upon the condition of the patient. So always we have to make sure we are explaining the complications and contraindication with the patient. How do patients get ready for robotic cardiac surgery? So here, as like other surgery, cardiac surgery, here the healthcare provider will be reviewing the medical history, lifestyle, as well as the severity of the disease. So we have to explain the patient about the severity of the disease and the prognosis. And the patient may be asking questions, so the healthcare provider is supposed to clear all the doubts of the patient. And we will be asking the patient to sign in the consent form so that the patient will be giving a willingness for the surgery. And when the patient is giving the consent, we have to make sure that the patient has read the form carefully. And if there is any questions, we have to clear all the doubts of the patient. And along with the complete medical history, the healthcare physician will be doing a physical examination in order to ensure that the patient is in good health condition before the procedure, and the patient is supposed to undergo some routine blood test and other diagnostic procedures. And even the healthcare provider may recommend taking an aspirin before the procedure. And in case that the patient is planning to be pregnant, we have to clarify with the patient. And if the patient has any allergy towards any medicines or any latex or iodine tape, contrast dyes, so we should collect the allergy history with the patient. And we should also, the healthcare provider also clarify the patient is using any traditional medicines, anything, and we have to clarify that the patient has any bleeding disorders or the patient is on any anticoagulant medicines. So what will happen is, so if you are doing the open heart surgery or the robotic surgery, there may be chance of bleeding. So if the patient is taking any anticoagulant medicines, anything better we will be withhold before the procedure. And the healthcare provider has to clarify if the patient has on pacemaker or any implanted heart devices, and the patient is a smoker, means we should advise the patient stop smoking, so because this will improve the chance of successful recovery from the surgery. And so commonly the patient will be asked to fast for 8 hours before the procedures, so they should not take anything by mouth, or any oral medication also should be withheld the previous day night. And based on the medical condition, the healthcare provider may request other any specific preparation for the patient. What happens during robotic cardiac surgery? So there are general sequence of events that will most likely occur during robotic surgery, and the patient may receive a sedation before the procedure in order to relax, and the patient will be placed under general anesthesia for the procedure, and the patient will be attached to a breathing tube that will be marked. And so here the surgeon will make a series of keyhole sized incision on the side of the chest. So this incision will align with the opening between the ribs, and the 3 small incisions, that is first they will make 3 small incisions or port or made in the space between the ribs, and the surgical instrument that is attached to the robotic arm, and 1 camera are placed through 3 ports, and some motion sensors are attached to the robotic wrist so that the surgeon can control the movement of the surgical instrument. And the surgeon sits at a computer console and looks through 2 lenses, one for each eye, that display mainly images from the 2 tiny cameras placed inside the patient. And the patient may be need to placed on the heart-lung machine for the procedure. Here you can see the robotic surgery incision, the incision made on the heart, that is, you can see the portal incision, how they made the portal incision. So here From the two optical outputs, the computer generates a clear three-dimensional image of the surgical site for the surgeon to view, and there will be foot pedals will be provided to for pressure camera control. So that initially the surgeon may zoom in and out to change the surgical view. So the surgeon can zoom the camera and he can view the surgery. And depending on the procedure being done, here the surgeon will insert several precision guided robotic arms, and these robotic arms hold and manipulate tiny instruments. And usually the three-dimensional image will be taken of the operated site. And the surgeon's hands control the movement and placement of the endoscopic installments, and the robotic arms and wrist movements mimic those of the surgeon. So there is a possibly more precise than the surgeon's natural hand and the wrist movement. And here the surgeon is allowed to control during the surgery, and there is no chance that the robotic arm will move on their own. So full control will be in the surgeon's side. So once complete, the surgeon will remove the instrument and close the incisions. What happens after robotic cardiac surgery? So once the surgery is over, the patient will be moved to the recovery area to be monitored continuously. The patient has to monitor, and the patient can expect a relatively short hospital stay for healing of the wound, and usually half as long after conventional open heart surgery. And once the pain is controlled and we can see the liquid down without the patient's side effect, any nausea, vomiting, and a lab test, everything is appears normal, the patient's hemodynamic status stable, we can discharge the patient. And the patient can also expect less scarring on the chest, because if you are comparing with open heart surgery, it may leave a 10-inch scar on the chest, but robotic cardiac surgery just leave a few small scars on the side of the chest. So once the patient is discharged from the hospital, so we have to explain the patient how they have to manage the pain. So even we can advise the patient to take, we can give some painkiller to control the pain like acetaminophen or ibuprofen. And so after some time the pain will be subsided, so we have to explain to the patient. Here you can see the robotic surgery incision, the incision made on the heart. That is, you can see the portal incision, how they made the portal incision. So here, from the two optical outputs, the computer generates a clear three-dimensional image of the surgical site for the surgeon to view, and there will be foot pedals will be provided for pressure camera control. So that initially the surgeon may zoom in and out to change the surgical view. So the surgeon can zoom the, and even the patient can return to normal activities more quickly when they are compared with the open heart surgery, and most of the people can resume their normal activities even after a few weeks, and the healthcare provider, we can give a pamphlet of recommendation of whatever the activities they are supposed to perform after the surgery. And we should also, the healthcare provider also clarify the patient is using any traditional medicines, anything, and we have to clarify that the patient has any bleeding disorders or the patient is on any anticoagulant medicines. So what will happen is, so if you are doing the open heart surgery or the robotic surgery, there may be chance of bleeding. So if the patient is taking any, and if you are taking the complications are rare after robotic heart surgery, but possible it's important to carefully monitor any symptoms and report them to healthcare provider. And remember to take all medicines as prescribed by the doctor. And so commonly the patient will be asked to fast for 8 hours before the procedures. So they should not take anything by mouth, or any oral medication also should be withheld the previous day night. and based on the medical condition, the healthcare provider may request are there any specific preparation for the patient, and even when and where to have the test, who will do the test, and what that person's qualification, and what would happen if patient did not have the test, and any alternative test or procedures to think about, when and how will you get the result, and who to call after the test or procedure if you have questions or problems, and how much will you have to pay for the test or procedure.